my name's Katrina Pavlinick with USF Health. We're practicing social distancing today, so I'm going to be behind the camera. But I'm joined today by Dr. Berlowtiz, who's a cardiologist at USF Health. And we're going to be talking about some topics in regards to COVID pertaining to the heart. So thanks so much for joining us. This is a great topic.
My pleasure.
Yeah, so the first question I want to ask is, how does the virus affect the heart from what we know right now?
Well, things are always changing. It's pretty fluid. I'm actually learning everything each day. But it's important to realize that 80% of patients don't have it affect the heart and their lungs either. Most patients are fairly asymptomatic. But for a small group of patients, it can affect the heart. The virus typically affects the lungs, but also other organs in the body. It can affect the heart two ways. The virus can directly attack the heart. And secondly, the virus can somehow elicit this big, huge cytokine response called cytokine storm, which could do some damage and put a lot of stress on the heart as well.
Okay, yeah, that's great information. And why is the virus particularly important for those patients that currently have heart disease?
This virus puts a lot of stress on the heart.
Sure.
So to fight infection, especially the more ill you are, the more stress it puts on the heart. So it's really important for patients that have underlying heart disease, heart failure, cardiomyopathy, arrhythmia, patients with coronary artery disease. All those patients are at particularly higher risk if they have to fight off this type of infection.
Okay, that's really great information. And what is the evidence for those heart patients?
So the evidence that we have.
Yes, I know it's going to be changing, got a lot going on, and I feel like every hour there's new stuff coming out, so.
And there might be, what I'm saying in the next hour might not be as accurate. But
sure.
From what we know now, 40% of hospitalized patients have underlying cardiac disease. Of those hospitalized patients, 10 to 20% of those patients have arrhythmia as a complication of their hospitalization. And 5 to 10% of those patients actually have direct heart injury from the virus. There are some case reports where patients recover from the lungs and actually do well from a respiratory standpoint, but later on in the illness develop damage to the heart from the direct attack the virus causes on the heart.
Okay, and are there special precautions for a heart patient that they should take to prevent the virus, or things that they should do maybe when they're in quarantine?
I think the virus, what we're learning about the virus, we should learn for everybody. So it's universal. It's not just the heart patient. Distancing, avoiding close contact, especially avoiding contact with patients that have had exposure to the virus or have symptoms. It's especially important if you have underlying cardiac disease. I think one thing that hasn't really been said is it's important to stay healthy.
Sure.
If you're a heart patient, stay healthy. Eat well, hydrate, exercise. I think it's important not to sit on the couch and just watch the news the entire Netflix 24 hours of the day, but to stay moving, to do the best that you can in staying healthy. I do know that USF and TGH have some initiatives to do things like telephone calls and telemedicine to try and provide cardiac care without having patients come in to hospitals or large centers to get exposure to other patients, which I think is also really important. So stay tuned. We're going to know more. The American College of Cardiology just came out with a guideline within the last 48 hours is not only how to treat patients that have cardiac disease and concomitant COVID-19, but also how to try and prevent contact and the general precautions for the whole population.
Sure, and there's been a lot of talk in the media about blood pressure medication and if there's any sort of effect with the virus. For what we know right now, do you have anything to comment on that?
So to speak in kind of the science terms, the virus attacks something called an ACE2 protein in the cell membrane. What does that mean? Well, there's a specific protein that the virus attacks, and that virus is in our heart as well as our lungs, mostly in our lungs. But there's medicines that people take that can interfere with this interaction, and so people didn't know whether medicines hurt or help the infection and the symptoms afterwards. What we know now is there's not a great correlation, so we're not really sure where it lies until we learn more. So the current recommendations are take your medications. If you're on medicines for blood pressure control, you're on medicines because you've had a heart attack, you're on medicines because you have a history of heart failure, it's important to take those medications. And it goes back to what we said earlier, stay healthy, right? So if you want to stay healthy, then taking your medications is a big part of that.
These heart disease patients are used to going out and being social, going to maybe the gym or something. What do you recommend to them? Do they do some meditating, call people, stop watching the news? What recommendations do you have?
If I could provide good recommendations for that, I think I'd be more than just giving a talk on cardiology.
Sure.
I think it's affecting everyone. We're all affected, all our families, our friends, our kids. It's very difficult to hear about social distancing, especially when we're all social people. I think from a cardiovascular perspective, staying healthy just means looking inside of things that you can do to yourself, people around you. Again, being confident that if you take the appropriate measures, there's actually a low risk of getting this virus. From what we know, and a low risk of being hospitalized and a low risk of mortality. But it's a very difficult question, a great question. I wish I could answer it. Maybe the psychiatrists of the world will start telemedicine and we could open up the lines to some good mental health professionals.